Bismillahirrahmanirrahim. Today our topic is diseases of the thyroid gland. In this we will discuss the disease of thyroid gland, but not in this video. Today we will only discuss hyperthyroidism, and the next video we will discuss the other disease. So, what is the normal function of the thyroid gland? The normal function of the thyroid gland is the secretion of L-thyroxine, which is called T4, and L3,3,5' triiodothyronine, which is T3. So this is the normal function that it secretes T4 and T3, and T4 and T3 influence bunches of metabolic function and processes in the body. We will discuss that later. What happens to the thyroid glands that the diseases occur? So there are certain diseases of the thyroid glands may be due to the qualitative or quantitative alteration in hormone secretion. It means that there will be the qualitative or the quantitative. Quantitative means increase or decrease, and the qualitative there will be in the iodine level or other level there will be the qualitative alteration in the hormone, so that will cause the disease of the thyroid gland. Enlargement of the gland are both. So qualitative or enlargement in one of these or both of these can cause at one time disease of the thyroid gland. Sometimes maybe the quantitative alteration in hormone, or sometimes enlargement of the gland only can cause the disease of the thyroid gland. When the hormones of the thyroid gland will be increases from its normal level, so it decreases from its normal level, so we will call that hypothyroidism, decrease in the T4 and T3. And when the T4 and the T3 hormones are increases from its normal, so we will call it hyperthyroidism. So there are enlargement. There are two types of enlargement of the thyroid gland. One is the generalized enlargement, in which the whole gland will be enlarged, and there will be a specific causes. We will discuss this in the certain diseases like grave diseases, Hashimoto thyroiditis, etc. And one is the focal enlargement, and the focal enlargement is mostly due to adenoma. So it will be in the small portion of the gland, not in the whole gland, so that is called the focal enlargement. Like for example, we have this gland and here is the problem, so this is the focal, and when we have problem in the whole the thyroid gland in all the lobes, so that is called generalized enlargement. So this is the difference, that the generalized enlargement the whole thyroid gland will be affected, and the focal enlargement only the one portion or the one focus will be affected. Maybe this or this can be affected. So then we will look for the general test, that how we can find the thyroid stimulating the thyroid function. So the most sensitive test is the thyroid stimulating test. We can also use total T4 and T3 level, but it can be elevated or decreased in some diseases or in some condition, but the free T4 and T3 will be normal. So that's why we always have to check free T4 and T3 for most sensitive and appropriate test. Like for example, the thyrosine binding globin in pregnancy and oral contraceptive pill will be increased, but free T4 will be normal. So it means that we have always we have to check the free T4 by the thyroid stimulating test and T4 T3 level. Then we can see that thyrosine binding globulin can be decreased in nephrotic syndrome and use of androgens, but the free T4 will be normal. So that's why we have to check always pre T4 and T3 as well as TSH level. Then in some condition like grave diseases, we are using the thyroid sensitive antibodies, immunoglobulins, in the grave disease. It also secretes an anti-thyroglobulin in Hashimoto disease. We will check in that case. So if we have increased thyroid stimulating immunoglobulins, so it means that the patient have grave disease, and if there is anti-thyroglobulin increase, so it is the Hashimoto's thyroiditis to that patient. Next is hyperthyroidism. It is also called thyrotoxicosis. So what is hyperthyroidism or thyrotoxicosis? It is the excess secretion of the thyroid hormone, that is T4 and T3, excess secretion from the normal. So there are some causes. So the primary cause is the grave disease. In the grave disease, thyroid stimulating immunoglobulin is increases, and that thyroid stimulating immunoglobulins it stimulate thyroid gland to secrete T4 and T3. So that's why T3 and T4 increases in the grave diseases. Then the secondary cause is pituitary adenoma, and there is when there is certain adenomas, so that adenomas that affect thyrotropes cells in the pituitary gland, so that secrete excess TSH, and that's why the T3 and T4 level will be increases in the blood circulation. Simple goiters in the thyroid gland can also increase, and there is one condition that is called toxic multinodular goiter or plumber disease. It is a non-autoimmune disorder. It also increases the excess secretion of the thyroid hormone. Thyrotoxicosis pictitia. What is this thyrotoxicosis pictitia? Thyrotoxicosis pictitia is when we use the thyroid gland from outer side, like for example from sheep we eat thyroid gland in the meat of the sheep. If we eat thyroid gland, so that can cause the increase in the level of T4 and T3 in the blood, so that is called thyrotoxicosis pictitia, and that's mostly in Americans. Okay. The next effect or the next cause is the Jod-Basedow effect. In the Jod-Basedow effect, a patient or someone is using iodine salt. So if he is using iodine salt for much long duration, so that salt increase the T4 synthesis. So that effect is that the use of the iodine salt increase the T4 synthesis. That effect is called Jod-Basedow effect. Then there are some drugs like amiodarone, antiarrhythmic drugs, and alpha interferon and lithium, which can also cause excess secretion of the T4 and T3 from the thyroid gland. And in very rarely condition, thyroid stimulating hormone excess secretion of TSH can cause thyrotoxicosis. So it is a very rare condition, and other causes. So these causes are can cause the hyperthyroidism. So that was all about the diseases of the thyroid gland. So simple overview of the thyroid gland as well as the hyperthyroidism. In the next video we will discuss the grave disease. Thank you so much.